If you experience hyperglycemia regularly, you should speak to your doctor or diabetes care team, according to the NHS. It can affect people with type 1 diabetes and type 2 diabetes, as well as pregnant women with gestational diabetes. Hyperglycemia can be potentially dangerous if blood sugar levels become very high or stay high for long periods. Your blood sugar levels, also known as blood glucose levels, are a measurement that show how much glucose you have in your blood. Diabetes UK says, your blood sugar levels go up and down throughout the day, and for people living with diabetes these changes are larger and happen more often than in people who don't have diabetes. The NHS notes that if you have diabetes, no matter how careful you are, you're likely to experience hyperglycemia at some point. It adds, occasional mild episodes are not usually a cause for concern and can be treated quite easily or may return to normal on their own. But hyperglycemia can be potentially dangerous if blood sugar levels become very high or stay high for long periods. Moderna vaccine side effects. EMA assessing reports of a new serious complication. In some cases, there may be no symptoms until the blood sugar level is very high, though you may spot some when you go to the toilet. Symptoms of hyperglycemia include needing to pee frequently and bladder infections. Other symptoms of hyperglycemia include increased thirst and a dry mouth, tiredness, blurred vision, unintentional weight loss and tummy pain. You may also find that you are feeling or being sick, or that your breath smells fruity. Prince Charles' health. Royals' embarrassing chronic condition, Insight 3 gum disease inducing foods to avoid or risk severe problems, warning arthritis diet, 5 arthritis-friendly foods you shouldn't live without, advice. The NHS warns, symptoms of hyperglycemia can also be caused by undiagnosed diabetes, so see a GP if this applies to you. You can have a test to check for the condition. Diabetes UK says that if you take certain medication, like insulin or sulfonylureas, checking your blood sugars is a vital part of living with diabetes. It adds that routine checks can help you know when you might be starting to go too low, called a hypo, or too high, called a hyper. The charity adds that more and more people with diabetes are choosing to use a flash glucose monitor to check their sugar levels, which is a sensor you wear on your skin and that you don't have to prick your finger to use. The Cleveland Clinic warns, if hyperglycemia is left untreated in people with type 1 diabetes, it can develop into ketoacidosis, where ketones, which are toxic acids, build up in the blood. This condition is an emergency situation that can lead to coma or death. In people with diabetes, hyperglycemia can be triggered by things like stress, being ill, not getting enough exercise or eating too much. The NHS notes, hyperglycemia should not be confused with hypoglycemia, which is when a person's blood sugar level drops too low. Diabetes UK says, hyperglycemia, or a hyper, can happen when your blood glucose, sugar, levels are too high, usually above 7 mmol/L before a meal and above 5 mmol/L 2 hours after a meal. It is normal for blood glucose levels to go up and down slightly throughout the day. Nonetheless, there are a number of ways you may be able to treat hyperglycemia. The NHS says you may be advised to change your diet, drink plenty of sugar-free fluids, exercise more often, or if you use insulin, adjust your dose. Until your blood sugar level is back under control, watch out for additional symptoms that could be a sign of a more serious condition, it adds.